Language of Caring helps healthcare organizations achieve an unparalleled patient experience and a culture of caring through exceptional communication.
So my name is Kathy Conaboy, and I am the Patient and Family Experience Manager here at the hospital. I first came here to the hospital when my son was 8 years old. He'd been injured in an accident, and he was a patient here for a long time, and after many, many months of intensive care, he was able to be released to home, and that started a long-term partnership with the hospital. My first exposure to language of caring was really very profound, because in listening to the skills and listening to the actual material, it really resonated with me and struck me that on many of my most challenging and difficult times here at the hospital, as the mother of a patient, I realized that what may have been missing from those encounters were some of the language skills that are taught in Language of Caring. My work with Language of Caring was to partner with a member of the clinical team, so family consultant and a clinical partner, and to go into units or practices and share the skills with the teams. My role was to share my story and to use pieces of the story to illustrate the different skills and why it was important and how you could bring it to life. The toolkit, the tool set, the language can help you right away on your job as soon as you learn about it that very same day. I spoke with a team over their lunch hour during a grand round session, and I shared the skills in my story. And I talked about things that really help make discussions and appointments with families go a lot better. And it was a great discussion. Later that afternoon, I ran into one of the clinicians. We were walking down the hall, and she passed me and she said, "I've just got to stop you and tell you, I just got done meeting with one of my families that we have the most difficult discussions. There's so many issues we're trying to cover, and it's always a very big struggle for me to try to help this family. I just use the language skills. We just had the best conversation we've ever had." She said, "Thank you, thank you, thank you. Can you send me your slides? Because I'd like to keep them in my back pocket, and every time I go on service, I want to refresh myself, because that just changed the way this family and I deal with each other, and it's made a complete difference in our relationship." So she was very excited, and I was very excited by that. I met with a team that was feeling very dissatisfied, feeling very frustrated. They were dealing with a very difficult situation, and they were really sad about it. And I brought the entire team into the room, from the senior fellow down to the folks who do the scheduling and the attending and everyone in between. And we sat and we talked, and I went through my story, I went through the skills, and I talked about things that work well and things that can really help recover a situation no matter how bad it seems. I showed how language skills could help them reconnect with this family. And when we were finished, there was just a moment of silence. There were no questions. And the senior attending leaned forward and said, "That was so profound and helpful. You will never know how much you've helped us in our practice. We think that everybody who ever comes to work here at the hospital should take this class, and we think every doctor who ever gets off the bus to get into medical school should take this class first and throughout their training." So that's how deeply that touched them, and I felt like even the clinician who was most closely aligned with the issue and the challenge with the family felt like we had given him almost a life preserver of how do I pull myself back into this and feel good again as a clinician and as someone who can have a relationship with this family. So he was very emotional. He got teary, and he felt like these things were going to help him. The reaction from staff has been very significant. They're very surprised. They're very ecstatic. "You're kidding me. That's all I have to do to bring family-centered care to life." Yes. Arrange your face, get to neutral, make a connection of presence with the family, take your hand off the doorknob in the BlackBerry. Say what you came to say, use the words, and finish up with a really profound expression of caring. You can take the same 2 to 3 minutes and make it a completely different experience for a family that will be remembered 20 years from now as very satisfying just by doing that. It's been very rewarding, I think, for staff to realize it's not some big thing that's very hard to understand or being dictated to them. It's how they do their thing within what they know is right in terms of their practice, and it's going to provide the results they're seeking anyway: satisfaction, a good connection with the family, a good plan that everybody knows what their role is, and everybody's happy.